If you don't want to die early, you better not quit smoking. This isn't some nonsense made up by an ambassador. It actually comes from a professor at a Japanese university named Takeda Kunihiko. He believes the idea that smoking causes cancer is a complete fallacy and even wrote a book titled If you don't want to die early, you better not quit smoking. In his book, he argues that smoking isn't the root cause of lung cancer, and that there's no direct evidence proving a causal relationship between cancer and cigarettes. This claim sparked widespread debate among medical experts and the public. Experts united to denounce him, firmly refuting his claims, while many netizens, especially smokers, strongly supported Takeda Kunihiko. So, is there really no direct evidence linking smoking to cancer? The truth is, humans have been using tobacco for 5,000 years, but we've only recognized its dangers in the last few decades. In fact, for over a century after tobacco was introduced, it was considered a miracle cure for all kinds of diseases. Ancient Native Americans believed tobacco was not just a ceremonial offering, but also a powerful medicine. In 1492, when Columbus and European colonizers arrived in the Americas, tobacco spread from there to Europe and eventually the rest of the world. Europeans adopted the Native American view of tobacco, also seeing it as a healing wonder. A Spanish doctor named Nicolas Monardes even claimed tobacco could treat over 20 diseases, including cancer. A bizarre new treatment even emerged: tobacco enemas. Doctors would blow smoke from burning tobacco into a patient's intestines to treat ailments like stomach pain, unconsciousness, or drowning. At the time, this was considered cutting-edge medical technology. But as more and more smokers died, people began questioning tobacco's safety. A massive war of words erupted between scientists, smokers, and tobacco companies. Victims claimed tobacco companies deliberately misled the public, causing countless deaths, while the companies insisted tobacco was harmless, even beneficial. By the 1950s, the first tobacco-related lawsuit was filed in the US by a smoker. After dragging on for 13 years, the case was lost. Global tobacco sales declined year after year. Even without direct proof that smoking was harmful, the rising number of unexplained smoker deaths made people wary. To save their market, tobacco companies launched an experiment in the 1970s to prove smoking was harmless. Scientists forced small, healthy beagles to smoke 100 cigarettes a day through masks. Dogs started dying unexpectedly, so they reduced the number to 30. Still, no dog lived past 3 years. The scientists were shocked. For centuries, tobacco was seen as a cure. Now they had proof it was deadly. If this got out, sales would plummet. So, they faked the results, declaring smoking harmless. They spent fortunes on ads, especially in old movies, where nearly every leading man smoked. Smokers, reassured, went back to their habits, and global cigarette sales rebounded to record highs. It took an undercover female journalist to expose the truth. In 1974, British reporter Mary Bath infiltrated a tobacco lab, working as a cleaner for a month. She discovered the dog experiments and documented everything. Her editor hesitated, fearing backlash from powerful figures, but after 6 months, he published her findings. Protests erupted, and cigarettes faced widespread backlash. As scientists studied tobacco further, its dangers became undeniable. Smoking does cause cancer, especially lung cancer. In 2015, China reported 733,000 new lung cancer cases. Only 150,000 were non-smokers. That same year, 52% of Chinese men smoked, compared to just 2.7% of women. Male lung cancer incidence was 50.9 per 100,000 annually, while women's was 22.4. If that's just statistical correlation, a 2016 study of 5,243 patients provided direct evidence. Scientists found smoking causes somatic cell mutations linked to 7 cancers, with lung cells mutating the most. Smoking a pack a day for a year causes 150 mutations in lung cells. Cigarettes contain 6 to 9 carcinogens, plus radioactive polonium and radon. These not only cause cancer, but also damage the heart, lungs, stomach, and other organs, leading to systemic harm. So whether you smoke or not, you should understand tobacco's risks. The idea that quitting smoking harms health is baseless. But does not smoking guarantee a longer life? Absolutely. In the 1950s, scientists launched a 50-year study tracking over 30,000 British male doctors. They recorded patients' smoking habits and lifespans. The results? Smokers lived 10 years less on average. The earlier they quit, the more years they gained. Sure, some smokers live past 100, but that's 1 in 10,000. The other 9,999 are ignored. Pushing this, smoking is harmless, narrative is either ignorant or malicious. Some people do experience withdrawal symptoms, or even get sick after quitting. Does that mean quitting kills you? No. According to Director Feng Hui from the PLA's 202nd Hospital, post-quit illnesses stem from pre-quit damage, not quitting itself. Tobacco's harm is cumulative and delayed. When the body, long adapted to nicotine, suddenly goes without, balance is disrupted, causing temporary issues like anxiety, depression, or poor sleep. These fade as the body adjusts. Take my own experience. I quit over 2 months ago after a reckless vow. The first 2 weeks were rough, withdrawal, back pain, then leg swelling. But 2 weeks ago, all symptoms vanished. My body had finally shed its nicotine dependence. So, what are the benefits of quitting? Besides gaining 10 years of life, quitting boosts fertility in both men and women. It prevents age-related diseases, improves metabolism, helping weight loss, enhances mental clarity, tightens skin, and brightens complexion. The lungs benefit most. Without smoke, their natural cleansing ability expels toxins. Over time, even long-accumulated damage lessens, lowering lung cancer risk. Most importantly, quitting at any age helps. If you must find a benefit to smoking, it's only in contributing tax revenue and shortening your own life. Smoking harms health. Quit now. Make sure to hit that subscribe button, give this video a thumbs up, and share it with your friends and family. Thanks a bunch.